So I had my baby boy and by an emergency caesarean section. I was discharged from hospital after a week. I became ill probably 2.5 weeks with flu-like symptoms, just feeling generally under the weather. By 4 to 6 weeks, I had a diagnosis of sepsis. So at 6 months after the caesarean, was told that I had to have a below knee bilateral amputation.
Sepsis is one of the leading causes of maternal death. Sepsis is the way the body responds to an infection. So it's always triggered by an infection, but in sepsis the body's immune system goes into overdrive, and if we don't stop it, that leads to organ damage and to death. In the days and weeks after childbirth, women are prone to developing postpartum sepsis because they are more at risk of infection. Women who've undergone caesarean section and therefore have a surgical wound are particularly at risk through wound infection, and that can precipitate the development of sepsis. Surgical site infections can lead to serious infection. 55% of surgical site infections are detected within 10 days of a caesarean section. 75% of infections are detected within 14 days of surgery, and 90% are present at 20 days following surgery. So it's vital that we look at women carefully, we examine their wounds to identify infection in order that we can safeguard these ladies.
So my first section with the twins, I wasn't quite sure what to expect. You're not given very much information after the delivery, baby's born and you're home to get on with recovery. It can be quite scary, you're not sure what pains are normal and what's not normal, you're not sure who to speak to or what's going on with your body. I think because caesareans are so common, the people around you think, well, baby's born now, the midwife's gone, you're fine now. Having had a second section and had the 5 guide information given to me, I think it helped all of us. It helped me remember that there's recovery physically still to go on even after discharge from the midwife. And when you're tempted to do a little bit too much, you remember that the reason you're uncomfortable is because you've still got those layers of healing going on there.
At least 1 in every 100 women will develop an infection in the postpartum period. So we all have a duty of care to safeguard the women we're looking after and to make sure that we identify sepsis early if it develops and get these people the help they urgently need. We have it in our hands to save lives, and the solution to saving lives from sepsis is awareness and communication. This is about getting the information into the hands of the people who need it most. So talk to the mothers you're looking after if you suspect an infection. Tell them about sepsis and what it looks like, and tell them that they might need to seek help urgently. Talk to your colleagues, talk to your own families, and make sure that we're all prepared and equipped with the knowledge to stop people succumbing to this killer condition.
As the chief nurse for the organisation, I'm really passionate about community services, always have been. And one of the things that really intrigues me is that when you think about sepsis, people tend to think about the older person or they think about the young child. They don't actually think about a woman going through childbirth and having to have a caesarean section, which is a big operation. I think over the years, some of the stats, 1 in 4 women will end up having a caesarean section, suggest to us it's become quite normal. And because of that, we haven't really focused on the potential impact of infection. And I think what the 5 Guide does, having looked at it, is it's a really quick and easy, simple, effective way of starting that conversation with the mother. There's a reason for not lifting. There's a reason for making sure you rest. There's a reason for making sure you eat well. There's a reason for not smoking. There's a reason for not taking too much alcohol. Have we explored that? So it's about making every contact count. So actually, from my perspective, the 5 Guide is an opportunity to tick a number of public health boxes for the benefit of the patient.
So on reflection, I would hope that 15 years on from my scare with sepsis, that families are valued in their opinions, that when they notice that things aren't quite right, that they are listened to, that professionals, health visitors, midwives, GPs, whoever that mum might be in contact with for those what are seemingly minor symptoms are listened to, but also that any woman having had a caesarean, that their wound is looked at and that health professionals think of sepsis.